The kinesiotape that we're going to be using now, it actually was invented by a chiropractor in the United States, but nobody would want to touch the way that he designed it. It has a bias so it stretches in one direction, but it has a whole lot of extra little rubberized type of kind of side stretching ability. So it had so many little complex things to it. Johnson & Johnson told him no, and he went to some of the other ones, and they also told him no. So from Japan is where this has been picked up. It first came out, they started using it in the Olympics. It was used on the Japan's volleyball team. And they taped, in fact, we got the same colors as what they used. Their outfits that they did their volleyball in were those two colors. And that's what they did. They put it on their shoulders and knees, and there was actually nothing wrong with most of the girls, but all of them were taped because it also enhances performance. Now, the top tape that we just put on, we came from by the spine and we came across the supraspinatus because of your rotator cuff irritation you're having. And by coming around the belly from where the muscle starts to where it actually hooks up, the attachment, it actually will stimulate the muscle. So actually, by coming around the belly of the muscle, from origin to insertion, it stimulates. So this is why we're putting it on in this direction. Now, because of the deltoid and the problem with spasms that you were having, we're actually going to start from the bottom where the deltoid attaches and go around to the top. So we're going to be pulling it in a different direction. So the way we put it on, you can stimulate a muscle, you can actually inhibit the muscle. It also is used when we work on, and I'll show you when we do the knee, that the knee itself, it can help to guide the patella so it tracks well as the down and dirty piece that we'll put right over the bottom of your patella to lift the tissue so you get swelling out as well as pain. So you have enhancing muscle, decreasing spasm, taking out swelling, and relieving pain. And this you can keep on 24/7 for several days. It's waterproof, so when you shower now, what I want you to do is just tap it dry when you're trying to dry it. If you rub it with a towel when it's wet, it's going to come right off. But we've had people that go in our pool and come out. And really the reason why we're doing this before you exercise, taking the pain down and giving you a little bit more strength to the muscle, you actually can perform better, and actually the exercises that we'll show you will work better. Okay? So let's go ahead and we'll do your knee next. The taping that we're going to do now is for the knee. You've come in and the doctor said you had a little chondromalacia, and trying to do some extension where you're moving the kneecap, you had some pain underneath. So we're going to guide the patella during the motion with the tape. And we're also, because you're having a little tendonitis right in the base underneath the patella where it attaches to the bone, we're going to do a kind of a technique to where you stretch and put the tape down so it lifts the tissue to take the pain out of that area. So let's go ahead and, so this is the guide that we're going to do, to try to guide that kneecap as you're extending and bending your knee. The one good thing about this Kinesiotape though, we used to do a lot of taping with a very heavy tape from Germany. And you pull the kneecap over and you tape it down. Well, the skin irritation from that was severe, as well as the problem is you didn't have that flexibility. Why this actually gives you the full flexibility without limiting any of your range of motion. This last Olympics, they had the girls that were doing the sand volleyball, the ones that won for the United States. She had a shoulder surgery, and she had the black tape that they were using on. The orthopedic doctor didn't even know why she was, had any tape on her shoulder, but she says it gave her a little bit more confidence with it. She actually played a little better and didn't have any of the pain with it like she was when she didn't have it on. And the other reason is that it gives you full mobility. And when you're spiking the ball for serving and such, playing volleyball, you need that motion. So you're not going to have any limited motion by keeping this tape on. Okay, the first piece that we use, this is the tape that's guiding the patella. Now this is what they would consider like a down and dirty, where you stretch it and put it down, and it's lifting where you have that tendonitis. So we're catching all of that. Okay? So you're good to go now with your exercises without having the pain. The other thing that I was talking about is just that it helps swelling. Now we didn't have anything for the patient we just showed you on his swelling. Here is a football player that took a helmet to the inside of the thigh. It left this large hematoma, or black and blue, with a lot of swelling to it. Now, the only thing that was done, this is 24 hours after the injury, they put the tape, and you make fingers out of the tape. So you cut the tape in half and in half again, and in half one more time. So you got about 8 little strips. Now, the strips go in towards the groin area where the lymph dumps, and they just very, very lightly stretch over the area, and it actually, you can see the discoloration is gone over the areas they put tape. So this was just for demonstration. Normally you would put a lot more fingers through from different directions to completely get rid of the ecchymosis as well as the swelling on it. So this is another way that the tape helps, is the edema and the actual black and blue.